that drugs can be very dangerous, even when they are meant to improve on our health, especially when they are not taken correctly or understanding the right way to administer them. Good morning, viewers of Gaza Media, and welcome to another enriching episode of Healthy Me. On today's episode, I will educate you on medication administration. Do not touch your screen, as I will be back with knowledgeable information concerning this topic. For presentation, I am Dwalem Karim. Please stay.
Taking your medication at the right time, in the right way and the right dose is very important, as medication may lead to worsened diseases and hospitalization, and in some cases may lead to death. Our regular medical contributor, Dr. Fezao, weighed and explained the importance of following strict instructions from the provider.
The body was created to defend itself against illnesses and stress. Sometimes it needs a push from medications and lifestyle modification.
Also, Dr. Fezao strongly kicks against buying or getting medicines from unreliable sources like roadside vendors, as it is risky due to constant exposure to the sun and high temperature, because medicines have strict storage conditions.
Sources of medication: prescribed or recommended by a provider, over the counter, roadside, especially back home, which is not recommended, from friends and families, which is also not recommended. It is highly recommended that medication come through a provider, as the reason for use, dosage, scheduling, side effect, drug-drug interactions may be discussed, which may help with compliance and adherence.
Again, medication safety is very important, and every patient must adhere to the directions given by the doctor or provider, says Kimberly, Drug Safety Officer at the American Federal Drug Enforcement Administration, FDA. Furthermore, medicines need to reach a certain level in your bloodstream for it to be effective. Thus, taking a dose too soon could lead to a drug level that are too high, and missing a dose or waiting too long between doses could lower the amount of drug in your body and keep it from working properly. Again, according to the Fonzo, medicine should be taken as prescribed, as it controls chronic conditions, treats temporal conditions, and overall long-term health and well-being. To conclude, diseases may sound or look similar but completely different. According to Dr. Fezao, patients should be able to discuss with their provider if they are unable to purchase a particular drug, as they may be cheaper alternatives.
People stop taking medications for different reasons. They're feeling better, lack of finance, side effects, misscheduling. For whatever reason, they stop. This may lead to medication resistance, improper treatment of the disease, and relapse. Please follow instructions on medication use. Discuss with your provider before stopping medication due to its side effect, or as soon as you stop taking the medications, as they are alternatives. Let your provider know that you are unable to afford certain medications, as they may be cheaper alternatives. Do not share medications with others. Disease may sound or look similar, but completely different. Remember to discuss with your provider the other medications that you take to avoid drug-drug interactions. Be careful the source of your medications, as medications were made to be stored at certain temperatures. Thank you.
Remember, health is wealth.
Thank you, viewers, for staying tuned to Gaza Media, and hope to see you on the next edition of Healthy Me. I bet you will be very enriching as usual, and of course very educative. Do not forget to subscribe, comment, like, and share. And if you ever wish Gaza Media to cover any event at all, do well to indicate through the numbers on your screen. I remain Dwalem Karim for presentation.